We've previously discussed a lot about facelifts, mini facelifts, what the differences are. I think there's still a fair bit of confusion for some patients with respect to when they go and see a surgeon and he quotes them for a facelift, what happens to the lower neck? Are they getting a platysmaplasty along with it? Is platysmaplasty along the facelift? So we wanted to address that question.
Yeah, a lot of patients are unsure whether they can get away with just neck liposuction alone to deal with extra skin and fat under the neck, or whether platysmaplasty includes that, or how does that differ from a facelift? So platysmaplasty really refers to tightening of this part of the platysmal muscle underneath the neck. All of us have a platysmal muscle which looks like a fan and comes all the way across the neck and is continuous with the little fibrous mass layer in our face. As we age, the fibers of the platysmal muscle, which normally come together like this, start to stretch and pull apart, and that's partly responsible for some of the heaviness and sag and apparent fullness that you see underneath the neck.
Yeah, think of it like a hammock. You know, the hammock just starts stretching out and sags on the bottom, and that's where you start to get some of the loosening in here. So one of the first things is if you've really got that laxity in here with the skin, in order to get a proper lift, you're really going to want to do a platysmaplasty. You need to go in and oversew that muscle and tighten that all over again. Mini lift is where they're really just making an incision along this earlobe area, elevating a small area and tucking back. In those sorts of cases, you're really not accomplishing anything with respect to that redundancy in the skin. You're not able to get this to tighten out. So you're not a candidate if that's what the main issue is for you.
So sometimes a lift is done at the same time as a platysmaplasty. The lift should really be thought about as taking care of tightening and contouring along the jawline, the lower cheek area around the mouth and jowls. But for tightening of this area under the neck, unless you're doing a platysmaplasty to bring those edges of the muscle back together and recreate that natural sling you had years ago, you're not going to get the optimal tightening underneath.
Yeah, so really important if you've been considering a facelift, when you do end up seeing a consult or a number of consults, make sure you understand what the surgeon's actually proposing. Is he just doing a little bit of a mini lift? Is he doing the platysmaplasty? How extensive is the lift itself? Those are all important questions for you to answer.